Hello, my name is Matt Torres. I'm one of the patient service managers at Christus Shoreline, and today I'm going to be walking you through the procedures we use to deliver and retrieve isolation patient trays here at Christus Spa and Shoreline. The safety of our patients and associates is paramount, so the most important part of the whole process is the correct donning and disposal of personal protective equipment, or PPE for short. Here we can see our associate Alexis preparing to deliver by unloading the tray from the cart, then performing hand hygiene. Alexis will now start the first step, which is donning the gown. This will provide full coverage from neck to knees, arms to the end of the wrist, and wrap around the back. She will fasten the gown on the back of the neck and the waist. Next, she's required to wear an N95 mask. This mask will have secure ties or elastic bands at the middle of the head and neck. It must fit snug to the face, below the chin, with a flexible band to fit the bridge of the nose. At our location, an N95 mask is always required while on patient units. This is why Alexis has her mask on already. For the final step, Alexis will be applying gloves by extending the gloves over her wrist and gown to prevent any skin exposure. Alexis should prevent touching any other surfaces before handling the patient tray before entering the room. Once Alexis enters the patient room, she will conduct her West scripting and any site-specific scripting as normal. Before exiting a patient's room, all PPE must be removed. Here is Alexis safely removing her PPE without contaminating her clothes or skin with infectious material. Alexis started by grabbing the shoulders and pulling the gown forward. The gloves will be removed with the gown. Both need to be rolled into a bundle with only the inside of the gown exposed. Alexis places the gown and gloves into a designated waste container inside of the patient's room and performs proper hand hygiene. For the retrieval process, conduct donning just as you would for delivery. Have a designated staff member responsible for picking up trays line up the opening of the cart as close as possible to the doorway of the room, ideally being able to place the tray in the cart without leaving the room. Associates will pick up the tray as usual, also conducting any other site-specific tasks while inside the room. Once the tray is placed into the cart, repeat the removal process of PPE just as you would for delivery. Thank you for your time, and please remember to consult with your risk management team to see if there are any other site-specific guidelines at your location.